Hello, my name is Andrew Brooks. This is Non-Linear Existentialism, Special Topic 2, Borderline Personality Disorder. In this presentation, we're going to be asking a question about theoretical relationship between the contradictory standards and residual incongruencies. The prologue of this is asking the question, as posed in Special Topic 1, about antisocial personality disorders. It was posed in this one that psychopathy was due to low amounts of residual incongruencies. Then from this, Special Topic 2 is asking the question that if psychopathy is due to low amount of residual incongruencies, perhaps there's going to be a personality disorder that's caused by a high amount of residual incongruencies. Throughout the course of this presentation, most of the time, please read the individual slides, and towards the end of the presentation, there's going to be a little bit of a discussion that I'm going to be posing about the topics that we brought up, how as they relate to borderline, and how they might also relate to psychopathy. In this one, this is just an overline of the borderline personality disorder as given by the DSM. As you can see, the main criteria are talking about an individual that has a fractured personality and also may come from a background that leads them into situations where they're not really sure about themselves. In these situations, that they become quite aggressive and anxious. Before getting into other aspects of this presentation, just a brief overview of some of the ideas that are given in non-linear existentialism that pertain specifically to this topic. They are secondary needs, feedback systems, standards, and the concepts that is defined by non-linear existentialism of quality and quantity. Secondary needs are going to be broken down between internally directed needs, ones that have set points, food, water, and the like, and externally directed needs, which are going to be not very specific, no specific set points. In this one, the idea is that the externally directed needs are the ones that are going to be more towards variances that might lead to borderline personality disorder because of contradictory standards. We have the stages of the feedback systems, and please just read these over. And on the following pages, we'll show the feedback loop that's proposed between positive and negative feedback loops, and where the secondary needs are considered as present, and residual incongruencies, those are stored within the cerebral cortex, are considered in the past. And you can see the interaction between the two. The important point in this one is in J, is that where normally X does not equal Y, as you'll see in the next page, but in borderline personality disorders, X can equal to Y, and that leads to a quandary, a contradiction in the standards, which can lead to increased residual incongruencies, which is the main point of this presentation. As I mentioned, contradictory conditions. For internally directed, lack of stable standards, the idea is that if someone's likes a specific type of food, it's always been good for them, and suddenly it isn't, and it occurred independent of what they have done, that can lead to contradictions and also to problems, instabilities within the cerebral cortex. And as a relation to this internally directed, where we have lack of stable standards as well, externally directed lack of stable standards, and again, this time we take the idea of nurturing, is that if you've got a child being in an environment where caregivers are not being very stable or consistent in their standards, it can lead to contradictions and can lead to the individual having difficulties in setting their own standards. And this is the variable standards I was talking about. General environment has some type of contradiction, but not much. In a normal child's environment, these contradictions are reduced somewhat because the caregivers normally try to provide nurturing and stabilize the environment. An abusive environment, as you can see by the red numbering, the higher the number and red, away from the normal background of 1, shows that the individual, the environment is very unstable, and it causes the individual himself to be quite unstable in his standards. And this one just showing the quality-quantity matrix about the background, about the interaction between quality and quantity, which are two very important ideas in the idea of internalizing external standards. And this one we have is that it comes to the idea of that matrix that at birth the person would not be able to recognize objects they have never experienced but have a means of making them meaningful. Again, that the energized states of the that occurs with the higher primary needs baseline activity level is what's going to be there as a non-specific, not a set point per se, as it's going to be specified to anything. There's just an overall level of activity that system deviates from and goes back towards. And this one is going to be just shown as a diagram of quality to quantity transformation. And you can just see with this one on the left-hand side, it have energy states from the outside coming to the inside, and it's basically taking energy that you have coming into the system, A1, that's going to be quantified in a certain amount that comes through into point B, which is going to be where the representations occur. As you go into the inside of the individual, these representations start to be, these energy levels start to do representations inside, and as we go further along, as we have the timeline, it's going to be going from high quality to high quantity. And again, that's how the quality gets quantified and gets realized within the cerebral cortex. And then that's how we have external standards coming, internal standards, and a primary needs baseline activity level is going to specify the upper limits of what the person has set at the beginning of their lives. It's going to be more pertaining to the amount of energy as to the designs of the patterns, the quantity, as it were, that's set within the system. For normal, there's going to be some levels of incongruencies and some unresolved residual incongruencies, but overall you can have a stabilized standards within the individual as it progresses forwards. Here you can see there's going to be a lot of instability and a reduced amount of energy, and the idea of going from quality to quantity, the amount of quantity is going to be reduced because of the instability in the system. As I said, the closer to the initial point, therefore, reduced quantity, increased quality. The outcome of this is basically taking what the 301.83 as set by the DSM-4R, the TR basically just taking every single one of them and just give them what we were talking about standards and how you can just see how one can be associated or correlated with the other. But please just go over those at your leisure. Conclusion, this is an important statement. The likelihood of borderline personality disorder occurring in a person increases in those dependent and developing populations, such as children, that are under the care of others who provide unstable environments. Such environments produce contradictory standards in the person under care, resulting in elevated numbers of residual incongruencies in the person's cortex, causing such persons to be reactive and unsure of their identities and how to relate to others. There are various treatments. The most important one is that it is quite preventable. The epilogue. Through this epilogue, please just read over these notes on this, but the thing is that what I'm bringing up in this topic is that thought's also very, very important. Usually if you think about the idea that the person's being brought up in an environment, and that environment is supposed to be, if you believe in what the behavioralists say, is supposed to be limiting what they are. But if you bring up the idea of non-linear or thought, that thought allows the individual to hopefully look beyond their circumstances and heal themselves in the future. And this is what it's basically saying, that although thought as defined by non-linear existentialism is responsible for the initial reframing, it can also readjust the system back to more functional standards. Initially, thought protects and growing the psyche from the full extent of the trauma. It can help the person understand that the contradiction in the standards that initially instigated the reduce their cerebral energy levels was not their fault. And what here I do is I try to show that we have a normal at the very top, the undisturbed functional state, and how through different amounts of trauma, we have trauma in the left-hand side, which is going to be for psychopathy. And for that individual, what happens is that it's so unstable at the beginning that it causes the primary needs baseline level to reduced, but that's because they have lower levels of thoughts in order to try to reduce the uncertainty between the individual elements, On the right-hand side, which is representative of someone who's borderline condition, what happens with them is that they do have the thought that allows them to try to bring in and to overcome the lack of stability between the standards. However, at the same time, we still have a high level of residual incongruencies, which you can see in the marked levels of the lines going back and forth, which is something that the system is having difficulty trying to stabilize. If you have any questions, please look at the cited documents at charitiesoflife.com. Thank you very much for your time and attention. Thank you. Goodbye.